Hey everyone, welcome back to MedEd 101. Today, we're diving into some must-know basics of health monitoring. We'll cover blood pressure, heart rate, respiration rate, oxygen saturation, blood sugar, and body temperature. Understanding these can help us spot early health concerns and maintain wellness. Let's jump right in. Blood pressure measures the force of blood against artery walls and is recorded as two numbers, systolic and diastolic. For adults, the average reading is around 120 over 80 millimeters of mercury. If it's consistently above 130 over 80, that's high blood pressure or hypertension. If it's under 90/60, that's considered low. In newborns, blood pressure is much lower, around 60 over 40 to 90 over 60 millimeters of mercury. Older adults may see slightly higher numbers. However, anything over 140/90 is typically considered too high. Very high blood pressure, above 180 over 120, is dangerous and needs urgent medical attention. Next is heart rate. This is the number of times your heart beats per minute, or BPM. A normal adult heart rate is typically between 60 to 100 beats per minute. Athletes may have lower resting rates, often in the 50s or lower. High heart rate, as known as tachycardia, starts at around 100 beats per minute or higher for adults. If it's consistently very high, around 120 beats per minute or more, it could indicate a health issue. A low heart rate, as known as bradycardia, is generally below 60 beats per minute for non-athletes, which might also signal a problem if there are other symptoms. For newborns and infants, heart rates are higher, generally 100 to 160 beats per minute for newborns, and 80 to 140 beats per minute for infants. Now let's talk about respiration rate, which is the number of breaths per minute. For a healthy adult, a normal rate is 12 to 20 breaths per minute. Newborns and infants breathe faster, about 30 to 60 breaths per minute for newborns and 20 to 40 for older infants. Anything below 12 or above 25 breaths per minute in adults could indicate an underlying issue, such as respiratory distress or an infection. Oxygen saturation tells us how well oxygen is being transported in the blood. It's usually measured with a pulse oximeter. Normal oxygen levels for a healthy adult or child should be around 95 to 100%. For newborns and infants, a normal range is similar, but often monitored closely in hospitals. Low oxygen levels, or hypoxia, generally means SpO2 below 90%, which could signal respiratory issues. Very low oxygen, below 80%, requires immediate medical attention as it can affect brain and organ function. Moving on to blood sugar levels. Blood sugar, or glucose level, is critical for energy balance and is measured in milligrams per deciliter. Normal fasting blood sugar should be around 70 to 100 milligrams per deciliter meals. A normal level might rise to around 140 milligrams per deciliter. For pre-diabetes, fasting blood sugar is 100 to 125 milligrams per deciliter, and anything above 126 milligrams per deciliter is considered diabetic. Managing blood sugar levels is essential to prevent diabetes and complications like heart disease and kidney damage. And finally, body temperature. A normal body temperature is usually around 98.6 degrees Fahrenheit or 37 degrees Celsius, but it can vary a bit. Low fever ranges from 99 degrees Fahrenheit to 100.4 degrees Fahrenheit or 37.2 degrees Celsius to 38 degrees Celsius. High fever is 100.4 degrees Fahrenheit or 38 degrees Celsius and above. For adults, a fever over 103 degrees Fahrenheit or 39.4 degrees Celsius is concerning. If temperature drops below 95 degrees Fahrenheit or 35 degrees Celsius, that's hypothermia, which is dangerous and needs urgent care. And that wraps up our quick overview of basic medical measurements. Knowing these levels can help you monitor your health or loved ones and make informed decisions. But remember, always consult with a healthcare provider for a full diagnosis. Don't forget to like, subscribe, and hit the bell to stay updated on more health tips. Thanks for watching, and stay healthy.